quality. I'm the Quality and Wellness Manager for the Authority, and joining me on the call this afternoon is my colleague, Mrs. Chandra Sawyer, who will be facilitating the meeting this afternoon. Thank you so much for joining us. This is a session we try to host every month for our beneficiaries to make sure that we're discussing the topics that concerns you and the things that impact your healthcare as we seek to advance the health and wellness of our beneficiaries at the Authority. We're looking forward to this afternoon, and our presenter, Mrs. Cates, who will be talking to you about diabetes management. And so I invite you, all of you, to please put your questions in the chat, and so that we can make sure that you leave this session with your questions answered. Mrs. Cates will be sharing the details around how to manage your diabetes, and Chandra and the rest of the team will be facilitating your questions. And so be sure to put them in the chat. So on behalf of the Authority and the board and the management and staff of the Authority, welcome to this month's educational session. We appreciate you taking the time this afternoon to share this forum with us, and hopefully that we'll be able to answer your questions and be able to have some dialogue around the topic this afternoon. So without further ado, I'm going to turn it over to Chandra, who is going to continue with the program. Chandra, over to you.
Good evening, everyone. On behalf of the National Health Insurance Authority, again, we want to welcome you to our beneficiary educational session. At the Authority, our vision statement is leading the way in providing access to affordable, quality healthcare that Bahamians deserve. Our mission statement, we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting our patients at the center of every decision we make. A little bit of our core values at the Authority. We are passionate. We are passionate about bringing universal healthcare to all Bahamians. We are a progressive establishment, and we are relentless in expanding access to quality healthcare through progressive solutions supported by technology. We believe in partnerships, and so we're dedicated to delivering affordable healthcare through partnerships. We are integrity-driven, and so we're committed to doing business with integrity, accountability, transparency, and sincerity. And we focus on respect by honoring our beneficiaries and providing care and respect in all aspects of our service. And so what is our focus as it relates to wellness at the Authority? As a part of our NHI Bahamas wellness program, we are dedicated to creating a platform where our beneficiaries, as well as the public at large, are encouraged and educated on adopting a healthy lifestyle by incorporating regular exercise into their daily routine, focusing on eating healthy, understanding that food is as medicine, and so it's important when we feed our bodies, focusing on our mental, emotional, physical, spiritual, and our psychological health. And these pillars play a vital role in our overall wellness and well-being. And so our goal is to ensure that Bahamians understand the importance of living a well-balanced life that will ultimately lead to enhancing the overall health and well-being of our nation. And so here's where we are now at the National Health Insurance Authority. At the Authority, we are making a difference, and we're deeply committed to leading the way in providing access to affordable quality healthcare. Since our inception in 2017, we have advanced the path to universal health coverage. And we've done this in a few ways. Our enrollment growth. We continue to offer primary care coverage, and we currently have over 140,000 Bahamian citizens as well as residents enrolled in our insurance, in our universal healthcare coverage program. Our demographics is diverse. So NHI currently enrolls Bahamians from more than 17 islands. And these include 6,700 plus Bahamians under the age of 5, and they make up a part of our pediatric population. and 16,000 plus Bahamians over the age of 65. And we call this population our precious pearls. Our patient satisfaction survey, which we conduct, the last time we would have conducted the satisfaction survey, it would have yielded a result of 96%, which stated that 96% of our beneficiaries that completed the satisfaction survey were satisfied with the service that they were receiving from the NHI Bahamas program. Our provider network is expansive, and currently there are 139 physicians that make up our network from 70 primary care physicians facilities. Our laboratory network is also expansive, which consists of 9 major labs across 16 locations and across 5 islands throughout the Commonwealth of the Bahamas. We like to boast about our digitally enabled care in the form of the electronic health record and the telehealth system. And so this beneficiary information is documented electronically, and it is enabled for applicable visits. A little bit about our benefits. This evening, our focus is diabetes. Yesterday, we celebrated globally World Diabetes Day. And under the NHI Bahamas program, a few of our primary care benefits include general physician visits, annual physicals as it relates to diabetes care and management, laboratory testing, as well as chronic disease management. And we not only focus on diabetes, but also hypertension, high blood cholesterol. And so we wanted to highlight those benefits that are specific to managing chronic diseases, in particular diabetes, this evening. This evening, our presenter, in the person of Nurse Anita Cates, she is a community nurse specialist practitioner and a Caribbean certified diabetes educator with over 25 years healthcare experience. She was trained in the United Kingdom as a registered nurse and furthered her education as a specialist community nurse in her hometown in England. In the past 20 years, she has focused on chronic disease management and prevention. She is the clinical director for Family Medicine Center and the Diabetes Education Network. Her subspecialty is technology-driven diabetes care, which includes the insulin pump therapy and continuous glucose monitoring. And Anita admits that she is a tech geek. She is the founder and vice president of the nonprofit organization ACE Diabetes, which stands for Awareness, Compassion, and Education. She is passionate about health and being a guest on various radio shows and TV shows, including Dr. David Allen's TV show, People Helping People, where she takes the time and the opportunity to educate on how individuals can make changes in their lives. Anita is the mother of 2 boys, so she's a boy mom. And she works closely and happily with her husband, Dr. Graham Cates, at the Family Medicine Center on Blake Road. She states that one of her greatest accomplishments was doing a parachute jump from 2,500 feet. We are glad that she landed safely, and she is here with us today. And so we would like to take this time to warmly welcome Nurse Anita Cates. And as Dr. McDonald would have shared earlier in the presentation, in the welcome remarks, that our question and answer period will be reserved for the end of Nurse Anita's presentation. And you are welcome to place your questions in the chat box, and we will happily read those questions to Nurse Cates. And so without further ado, Nurse Cates, you are on.
Oh, thank you so much. It is a pleasure to be here to chat to you all about my favorite topic, which is diabetes, the prevention of diabetes and the management of diabetes. And my plan for all of us tonight is to go home with hope and to go home with an excitement of being healthy, being whole, and also wanting to make changes into your life that are going to make a difference. So I am going to pop on my very short presentation. And then once we've done that, I'm going to go into other areas of diabetes management, which actually sits really well with the philosophy of NHI. So, for example, you will remember that was said in the presentation that there's all these areas of wellness: mental, emotional, spiritual, physical, and psychological health. And diabetes education takes all of this into consideration, because at the end of the day, we're all people. We all have our own little quirks and needs, but we all have this outstanding need to be the fittest and the healthiest that we can be, regardless of what is going on around us. So please put your questions into the box. I will answer them at the end. I might not be able to talk about your situation specifically, but if you do have any general questions, please type them in, and type them in as we're going along, because by the time we get to the end, you might have forgotten. So let me share my screen with you. So one sec. I am actually really proud of my little slides. It's one of the things that I do take quite a lot of pride in. So what I'm going to do is, let's just do, there you go, from the beginning. Diabetes, what do you need to know? Quite honestly, we could be here all night talking about diabetes, but really, we're going to nail it down to some very, very important aspects. And you can see on the left-hand side, I do actually represent 3 organizations. So Family Medicine Center, which is over on Blake Road, and our little sister company, the Diabetes Education Network, which was running wonderfully well. And then in 2011, I just realized there was such a need for diabetes education. So ACE Diabetes came into being. And in fact, for this year, we know that the theme for World Diabetes Day is education, protect for the future. So I am positive that the way forward is through continued education. But of course, education is not just about knowledge, but it's about action. And that's where I step in, is being able to not only inform you of the things that you need to do to prevent diabetes and to manage diabetes. I'm here to kind of guide you and assist you and your families on making those changes and taking action. So, little bit of a pop quiz. We have, I believe, according to the IDF, the International Diabetes Federation, in 2021, we had an adult population in the Bahamas of about 290,000 people. Out of that, believe it or not, we have 26,000 people, about 9.4% of people in the Bahamas have diabetes, and that's a blood sugar that is diagnostic of diabetes. What's not included in that is a condition called pre-diabetes, where people do have a slight elevation. You may have heard it as a touch of sugar. So we're going to talk a little bit about that tonight. And we're also going to talk about the differences between type 1, type 2, and also pre-diabetes. So yeah, 9.4 is actually probably much higher if we put in the numbers of the persons with pre-diabetes as well. So let me click on to our next slide. So diabetes, what is it that you need to know apart from everything? So I know there's a lot of information out there on the internet, can get a little confusing. And it can get a little confusing with the information that's sent around with friends and family. So we'll try and clear some of that up tonight. So yeah, we are going to talk a little bit about type 1, type 2, and pre-diabetes and what is the difference. And then we're going to do a little quiz. So please take this moment to grab a pen, a piece of paper, and if you don't have that available, we are then going to talk about, we're going to use your fingers. So we'll be fine. We've all got 10 fingers, so we're going to be good with that. We're going to lean into the prevention and management of diabetes, which again leans very nicely into the NHI plan when it comes to activity and allowing food to be your medicine. So yes, we are going to cover one of probably the most important things that's on your mind, and what you need to know is, what am I supposed to eat? So we can have a really, really good chat about that. And I'm just going to outline some things for us. And then we're going to look at what's next. And while we're having a little chat about what's going to be coming up, you will also have the opportunity to put in your questions as well. Oh, and by the way, if you do have a question, and Shauna, please, if there's something that I need to clarify, please just say, I don't understand this, can you repeat it? You're going to be my my monitor. Is that okay?
Yes, definitely. I can do that.
Perfect. Yeah. And shout out if there's any questions that come along that I need to address. So this is a really nice little chart because it tells us a little bit between the difference of type 1 and type 2 diabetes. And this is really important because there is a difference. And so let's chat about what type 1 is and what type 2 is. Well, type 1, by the way, there are many forms of diabetes. It tends to make up about 10% of all people who have diabetes. Whereas with type 2 diabetes, this is the big one, right? This is the one where you hear about that most people have. And that works out to be about 90% of the population with diabetes, which is type 2. So type 1 diabetes is caused by an autoimmune condition where it actually attacks the pancreas, and the pancreas no longer produces insulin. And that person has to have insulin. If they don't have insulin, they will die. We need insulin to work. Now, type 2 is different. A person with type 2 diabetes doesn't produce enough insulin for the high blood sugars, and the body really doesn't react to the insulin either. So it's two different mechanisms of action. And let me explain this. So we have cells in our body, and I hope you can see me on the screen, these little cells. Let me just, I'm going to so I'll let you, if you can sit on me and be able to see. We have cells in our body, and they require glucose. And insulin is a little key which comes along, and it unlocks the doorway and allows the glucose to go inside for energy. In type 1 diabetes, there's no keys. So even though the cell can accept insulin, it's still not going to open because there's no keys. It's like you're locked out of your house because you left your keys at home. Now, in type 2 diabetes, there are some keys, but when the key tries to go into the lock doesn't work. So then the problem is that the glucose builds up in the system like it does with type 1 diabetes. Pre-diabetes, on the other hand, is a condition which starts off maybe even 10 years before type 2 diabetes occurs. And we see a slight elevation in the blood sugar. And it's not enough to be called type 2 diabetes, but it's elevated. And any elevation in blood sugar is something to be concerned about. But the good news is If you are told you have pre-diabetes or a touch of sugar, there's never a touch of sugar, by the way, you have the ability to turn that around and reverse. So let's talk about that. Type 1 diabetes cannot be reversed. We're still working on that. Type 2 diabetes, if you're in the early stages, it's possible with lifestyle changes. But if you've had diabetes for a very long time, 10, 20 years, the chances of reversal are much, much, much less. So warning signs of type 1 diabetes, usually it's very, very sudden. Increased thirst, going to the bathroom, constant hunger, significant weight loss, blurry vision, and extreme tiredness. Type 2 diabetes and pre-diabetes are a little trickier because sometimes there are no symptoms. The body's really good at adapting too. And often we don't tend to get those symptoms until the blood sugars are very, very high. So the warning signs of feeling very tired, you might have a wound that doesn't heal. You may have pain, numbness, tingling in the hands and feet. And also, you may just not feel 100%. Your brain might feel a little bit foggy. Now, what is it caused by? Type 1 diabetes, we think, we're not sure, is caused by genetics. If you have a person in your family with type 1, you're more likely to get it, or develop it, I should say. Environmental, autoimmune factors, we're not 100%, and therefore it can't be prevented. However, with type 2 diabetes and pre-diabetes, there are some things you can change, such as your lifestyle. You can change that. You can also change it through healthy eating, exercise, and weight loss. And we know that those things do cause, or lack of those, lack of exercise, not eating well enough, can lead to type 2. However, and especially in our population, we're seeing more and more people who are fit, healthy, they're exercising, they're a great weight, but because of the genetics, they're developing type 2. So there's this family history, mom, dad, brothers, sisters. Another thing that type 2 is caused by is aging. Sadly, the older we get, the more likely we are to get type 2 diabetes. And also being of Afro-Caribbean descent as well, certainly is another problem. You're definitely more likely to get diabetes. Another thing that's not mentioned on here, but is super important for our population, are ladies. Now, ladies, when you are pregnant and you have diabetes or you have gestational diabetes, it's really important that you manage your blood sugars, obviously, for a healthy pregnancy and a healthy baby. But what we do know is that those moms who are struggling to manage their diabetes and the blood sugar is very, very high throughout, even though the pregnancy goes well, that child is far more at risk of developing type 2 diabetes later on in life. And that's called epigenetics. So if you're a baby of a mom who was unable to control her blood sugars for whatever reason, you are definitely more at risk of type 2. And that's something that you can't change. Treatment's different. Oh, I am sorry. Treatment is different. So treatment for type 1 is insulin. And of course, we want to be able to eat healthy, exercise, monitoring the blood sugars. Type 2 is pretty much the same as pre-diabetes. We're looking at diet, we're looking at exercise, glucose monitoring, oral medication, and in some medication, in some instances, insulin. Now, there's a reason for this. This doesn't mean that you have automatically now slipped into type 1 diabetes. That's not true. Sometimes the body is just not producing enough insulin. Right? And when that happens, obviously the blood sugars rise. When the blood sugars get really high, it causes glucose toxicity in the pancreas, and it damages the beta cells, which make the insulin. So in a lot of cases, there is such low amounts of insulin that we actually do need to give insulin to those people who have type 2 diabetes. So I hope that kind of clears up the differences between type 1, type 2 diabetes, and with an understanding that pre-diabetes is the very early stages of type 2 diabetes. We can see pre-diabetes in type 1, and often that's found in children of parents with type 1 who were monitoring for the development of type 1 diabetes. So
hi, Nurse Cates. Yes. I just wanted to pop in because you mentioned pre-diabetes. So is there, so we're talking about type 1 and type 2 diabetes, right? At which point does an individual or a patient switch from pre-diabetic to diabetic?
Oh, it's a great question. And it's all in the diagnosis and it's all in numbers, right? So there are different diagnostic criteria, right? So that is from a blood sample that is taken from your vein. So you get up in the morning, you go to your doctors, you have your blood sample taken, and then he gives you the results. And there's 2 results that we get from that. And we know that if we are in a certain range, so if that fasting blood sugar, and I know it's a lot of numbers, I'm so sorry, is between 100 to 125 fasting sample, you are pre-diabetes, you have pre-diabetes, and there are other tests as well that we can do, like an HbA1c test. Anything that's 126 from a sample that's taken through a laboratory, not from your finger stick, a sample taken through me, you can have a diagnosis of type 2 diabetes. So Chandra, it is all actually based on the diagnostic criteria that the doctor gives you. However, a high blood sugar is a high blood sugar.
Yeah.
And it causes complications. Yes, my love.
So is there a certain time frame? Like, do we test 3 times, or is it just the first time that you test 125 milligrams per deciliter? I just want to know, because I know that may be a question that's in some individuals' mind.
I think it's valid, right?
Yeah.
So there are several ways of checking for diabetes when it comes to a blood test, and there are 3. There's the fasting sample we just spoke about, and then the other criteria, the other tests that we like to use is called the HbA1c test. So often we'll do a fasting sample and then we'll run an A1C at the side of it. An A1C gives us an average blood sugar over the past 3 months. And if that's elevated, it's diabetes as well. So we got 2 there, right? If it's slightly elevated, we could say it's pre-diabetes. So it's like a double check system. Now, if we are still not sure, what we can then do is do something, a glucose tolerance test. That's when you come in and you have a fasting blood sample taken, and then they make you drink this really, really sweet orange Fanta. It's not really Fanta, but it tastes like it. And then you have your blood sugar checked afterwards. And again, depending on the range will say, okay, everything's normal, or you're pre-diabetic, or in fact, yes, you do have diabetes. So those are the tests.
Okay, so that makes it a little bit more comprehensible for me. Yes, it's very comprehensive type testing. Yeah.
And while we're on to testing, and then I'll skip, type 1 diabetes can sometimes look and smell like type 2 diabetes. So in order for us to check that, we need to do blood samples which check for autoimmune conditions. We also need to check for other parameters like C-peptide, insulin. So in type 1 diabetes, we need to do antibody testing to help us to get a different diagnosis, so we can make sure that we're given the right plan, which is good. All right, so let me get on to my next one. Oh, yes. This is when you are going to take out your pen and paper or count on your fingers. Am I at risk of diabetes? So there may be those of you who already know you have diabetes in the room, but these are for people who are not sure. You might have family history. You're just not sure if you're at risk. So there is a risk assessment that we're going to go through now. So grab your pens. So how old are you? If you're less than 40, like me, I wish I was, 0 points. 40 to 49, 1 point. 50 to 59, 2 points. And if you're 60 and older, it's 3 points. Remember, your risk factor does tend to go up when we get older. Now, if you're a man, you get 1 point. Women, no points. I'm not sure why. If you're going to ask me that question, I need to do some research on that. But yes, sadly, men do have a tendency to be more at risk when it comes to this. So hopefully you should have added your points is more common. So if you're a woman, and if you have ever been diagnosed with gestational diabetes, give yourself 1 point. If not, then no. And obviously men, it would be no points. If you have had diabetes in pregnancy, you are more likely to develop type 2 diabetes as you stop your pregnancy and carry on in life. If you have a mother, father, sister, brother with diabetes, if you do, give yourself another point. If you don't, 0 points. If you have been ever diagnosed with high blood pressure, it's 1. If you do not have high blood pressure, never been diagnosed, 0 points. If you are physically active, no points. If you don't do it, now when I mean physically active, I don't mean being busy at work, I walk to my printer. I'm talking about having an exercise routine where you do get up several days a week and you go out for a walk or you hit the gym. That's what we're talking about, being physically active. Now, does anybody want me to repeat those? You should all have your numbers. Sean, do you have your numbers?
I do.
Perfect. Okay, let's see what the big reveal is. Oh, no, not yet. It's the weight category. Oh, dear. So what we're going to do is look at the in the middle where this chart is. You're going to find on the left-hand side how tall you are, and then you're going to find your weight. So let's say you're 5'11" and you weigh 295 pounds at 5'11". You go across and you will find that anything that's 286 plus, you give yourself 3 points. If you weigh less than the amount that's shown on the column, so if you're 5'6" and your weight is 120 pounds, then you don't get any points. So I'm just going to stop here. Chandra, why don't you give me a shout when you found your weight? I presume other people will be kind of working this with you.
I found mine.
Okay, good. And you've got your point?
I do have my points, yes.
Perfect. Oh, no points at all, I should say. Right. So don't worry, I'm not going to embarrass you. So here's the big reveal. Right. If you have 5 or more points, you are at risk of prediabetes and type 2 diabetes. So for a few of you in the room, this might be a surprise. For others in the room, you might have already kind of known that you were at risk. So what happens next? Well, the first thing that we actually need to do is, and I'm just going to stop this share for the moment. Let me just stop this. 1 sec, because I want you to be able to kind of see me. So here's where it gets really important, is that if you're at risk of type 2 diabetes or pre-diabetes, what I want you to do is make the effort to go and see your physician and have your fasting blood samples taken. And I know y'all love getting needles, so I hear that. But it's important to get that done and get the bloods taken from here or from the back of your hand, but it's not a finger stick, right? So you're going to go and see your physician who you've aligned yourself with NHI. And as part of your annual physical, you're going to have your bloods taken. My advice is for top tips for getting your blood samples taken. If you drink a lot of water the night before and the morning of, it's going to be much easier for you to have your blood sample taken, but only water, nothing else. No juice, no gum, no nothing, just water. And that helps fill the veins up. It makes you feel better when you have your blood test done. And then the other thing, they're not kind of digging around trying to find the vein. So water before. Once you get the results, you need to see if you can get a copy of your results or photograph your results. If your physician says, oh, everything's fine, well, that's wonderful. But see if you can get a copy and make sure that that fasting blood sugar, when trying to ingrain it in your head, should be less than 100. If it's slightly above, then it's pre-diabetes. And if it's above 120, if it's 126 and above, it is diabetes. So keep an eye on that and pay a visit to your physician. So what are some of the things that you can do? Well, food is your medicine. That's what we talk about within the National Health Insurance. So let me go back to screen. All right, cool. There we go. Now, you might have seen this before. It's probably one of the easiest things when it comes to management of our health is the plate method. It's probably the easiest. It is probably the most effective because we can actually put on here foods that we like, but in the right portion sizes. So let's talk about this guy right here. Water or 0-calorie drink. I hate to be the bringer of bad news, but honestly, juice, soda, Vitamalt, and wait for it, coconut water, even from the tree, all contain sugar and will elevate the blood sugar and leave you at a more at risk of developing type 2, or if you already have diabetes, it's going to push your sugar up. So let me just talk a little bit about coconut water, because I know we see a lot of it on the streets and it's great, right? It's a lot of great nutrients in. Where we go wrong is we drink way too much. So really, when you're looking, if you do want to drink the water, you're looking at about a cup, which is about 8 ounces. We don't really need any more of that. And within that cup, I was able to research, there's about a teaspoon of sugar. So yes, it can be used, but in smaller amounts. So be mindful of what you drink and please try to avoid additional sugars in your tea and coffee. I've seen it, I know it goes, those little paper cups have about 10 teaspoons in there. If you wish to use sweeteners, go ahead. Is it the best thing? Not really. It's not going to harm you, but it's not going to be beneficial. So my recommendation is that you get used to a point, and you will, where you don't require sugar in your drinks anymore. And we should all do that. That's for us across the board. On the left-hand side here, we have our non-starchy vegetables. So half of your plate should be filled with vegetables that grow above the ground. So that's all of your broccoli, your lettuce, your tomatoes, okra, bok choy. Let's think about spinach, maybe collard greens, cabbage. These type of vegetables are really good for us. They've got a lot of fiber, a lot of nutrients in there, and they should always take up half our plate. The protein foods, if you eat protein and you're not a vegan, is meat, fish. We're looking at chicken, we're looking at turkey. all of the meat products. And yes, ideally, when possible, going along with the lower fats and having the higher fat meats, not often, right? So on special occasions, but making sure that most of your meals have protein, which is low in fat. Those people who have who are on a vegan diet, you know where you get your protein from, but protein can also come from beans and legumes, tofu. But bearing in mind that if you have a lot of beans and if you have a lot of legumes and if you have chickpeas, that type of thing, that also has carbohydrates in there too. So you do have to be mindful that you don't overdo it on the carbohydrates because they turn into sugar, right? So the carbohydrates, that would include the veggies that are underneath the ground, potato, cassava, sweet potato. And contrary to belief is that white potato and sweet potato, yes, sweet potato does have more nutrients. It can be better for you, but it's going to elevate the blood sugar just as much as a regular potato. So we do have to be mindful. We do have to be mindful of cassava as well. Oh, plantain would go in this spot. And oh my gosh, I love fried plantain. And corn would go here as well. So when you're dividing your food up, and I'm just going to kind of give you an idea of what this looks like from a cultural perspective, right? When we think about the foods that we eat here in the Bahamas. So just some breakfast ideas I have here. And an omelette. So this obviously it's eggs with vegetables, because we said we wanted some vegetables on there, and maybe 1 to 2 slices of whole wheat toast. Not going to throw your blood sugar up too much. If you wanted to pull back on the toast, we recommend 1. Smoothies can be good, but heads up on smoothies, they have to be done properly. So we recommend mainly vegetables in there, such as spinach and kale, using a very low carbohydrate milk, and using maybe a scoop of protein powder, but don't fill up your smoothies with all of the fruits because it's going to make the blood sugar go through the roof. Yes, you can use a little bit of oatmeal. You can use some nuts and eggs. Oh, here, let's go to this. Chicken sauce, probably one of my favorites. And we can also use this as boiled fish too. So the chicken sauce and the boiled fish, we've got potatoes in there. So small amount of potatoes, it will elevate the blood sugar. Or you might prefer Johnny cake. Don't shoot the messenger. We've got to think about smaller pieces of Johnny cake, about 2.5 inches. If you know what an inch is normally your thumb. So 2-inch squared of that. Yeah, I know, I'm sorry. And then a small amount of cooked grits, which is usually about 1/2 cup. A cup may be a bit too much. This might, like I said, it happens with boiled fish as well. You could use the boiled fish here. Stewed conch. Ooh, that's one of my favorites. Again, you've got the flour in there, which might have, obviously that's going to increase the blood sugars. So eat in smaller amounts. I'm certainly not saying stop that. That wouldn't be fun at all. One of my favorites, tuna salad. It works really, really well for us. And we're looking at small amounts of grits, mackerel, small amounts of grits, and then just some snack ideas. And we want healthy snacks. And you can see them there. I don't need to go through them all. But what I have done is it's good to match. You know, if you're going to have some fruits, have some vegetables with it. If you're going to have some fruit and you want some nuts, that's a healthy thing. So we're looking about thinking outside of the box. And I mean that specifically when it comes to making sure we're not eating processed foods, that we really are making choices that are going to be in our best interest. And we're so blessed at this time of year because the markets are going to be opening up, aren't they? We've got I think it's Carmichael. They're going to be having their little market. So, you know, we are going to see some more fresh vegetables out on the market. Just some lunch and dinner ideas. And it's the same. If you use your plate, you can see there some of the things that I've popped in. Curry chicken, one of my favorite. You could use some veggies on the side with that and some rice, a small amount of rice with that. But remember, you've got all your veggies that go along with that. Oh, and here's another of my favorites. I know it's your favorite too. It's going to be fried snapper. So, yeah, fried snapper, coleslaw, which would be your veggie component, but no sugar, no sugar. I don't know who thought of putting sugar with vegetables, but no sugar. And then you can choose, right? What's your favorite? Do you want small amount of peas and rice? Are you going to want a small amount of potato salad? Or are you going to want a small amount of mac and cheese? So just think about what do you really want, and just pull back on the portion sizes is really going to help to reduce your weight, as well as your risk of developing pre-diabetes, your risk of developing diabetes, and it's going to go a long way in managing your blood sugars as well. And I just want to be very mindful of the time right here. So what I want to talk about, Chandra, how much longer have I got? I want to be very mindful of our time.
You have about 10 minutes.
Okay, perfect.
Yeah.
That's
and
good.
then we can
we
open for
kind of
question and
wrap it
answer.
up.
Yes.
That's great. Yes, I'll have wrapped up before then. So that's good. So if you remember, what NHI was explaining about was and promoting exercise. I think the Bahamas has done a fantastic job in the past 20 years. I mean, you will remember back in the day, I think it was Gold's Gym down at the bottom of the bridge, and that was it. But now we're seeing more and more gyms popping up. We're seeing people exercising. So exercise is definitely an important part of our life. And it's important for everything. So having an exercise routine, and it's whatever you want to do. So there's no real, this is the best exercise. The best exercise is what fits you. And you can do it whenever you feel as though you are able to fit it in. But the main thing about exercise is you have to enjoy it. So make the opportunity to do different things, try different exercises. So there are 7 parts to diabetes management and also to diabetes prevention. We've quickly spoken about healthy eating. We've spoken about being active. That definitely decreases your risk. Being more active because it actually burns off glucose. If you have a high blood sugar and you go out to exercise, your body naturally burns that off. So there's a physiological reaction that happens that's beneficial. An important thing, and this kind of fits into the psychosocial bit about, is that eating healthy, exercising, changing your life can be a challenge, right? Because we have all of our stresses and strains, and it can be a challenge when you have diabetes or pre-diabetes or any condition. So I highly recommend that if you're struggling, that you get some supports and help. And you can do that very easily through ACE Diabetes. We have like a little support network so you can help one another. So having that guidance and support of people around you to make those changes, really important. Medication. I know you all love medication. Nobody loves medication. But if you were prescribed medication, it is really important that you take it. If you're not comfortable with it, then please go back to your doctor and explain why you don't want to take it. As physicians and nurses, we do not take giving medication lightly, or we shouldn't. We're always thinking, what are the benefits? What are the downfalls? How can we prevent complications? So please have an open dialogue with your physician on medication and never stop your medication without prior discussion with your healthcare team. Monitoring is quite important as well. We've already spoken about the importance of going to your physician and having your blood sugars checked from the vein, but you have a responsibility too. If you find out that you have pre-diabetes, or if you have diabetes, you should be monitoring your blood sugars. And at ACE Diabetes, we can certainly support you in how to do that and how to get the best of your numbers, right? So the last one, when it comes, and I will wrap it up right here, is that yes, there are a lot of complications that can occur with diabetes. And the good news is they don't have to happen. It's not an automatic thing that you automatically get complications because you have diabetes. Complications occur when blood sugars have gone so high, they are unnoticed and unmanaged. And that's when you hear about people who lose their eyesight, strokes, heart attacks, kidney failure, erectile dysfunction, sexual dysfunction in women, foot problems, and a whole gamut of problems, from as simple as having issues with your mouth and with your gums. So our whole system is affected by diabetes. So in order to wrap this up now, I want to encourage you that if you are at risk of diabetes, please go and see your physician, get your bloods checked. If you have diabetes or pre-diabetes, take action. You are 100% responsible for your health, and you're totally capable of doing it, and you deserve a fit and a healthy lifestyle. So I just want to reassure you, complications do not have to happen. And on that note, I just wish you a wonderful and wonderful diabetes month. Stay focused in on your health and continue to learn more about diabetes and how you can manage it. And most of all, how you can prevent diabetes from happening in the first place. And I'll take your questions.
Thank you, Nurse Cates. That was such a very, very informative session, very dynamic. I enjoyed the energy. I enjoyed the level of engagement, and I like that you kept it very, very simple and understand. We were able to understand and follow you in a manner that makes it easy for us to now walk away. And for those of us that may be struggling with diabetes or know someone that may be struggling with diabetes, I'm hoping that as a result of this call, we can go away being better informed, empowered, and able to make a difference and act. I know Ms. Cates, just to go off topic just a little bit, not too much, because we are in Diabetes Month. I know ACE Diabetes have a lot of events going on. And yes, NHI Bahamas is also doing some initiatives within the community, particularly with our educators as it relates to diabetes. But can you inform those of us on the call of any other opportunities for awareness as well as education and even screenings that may be offered this month?
I am so glad that you said that, because on Friday, I am going to be outside Kelly's. You'll see a big tent right outside the front door. I do want you to come over and hang out with me. I am going to be doing some quick blood sugar checks. We can talk about your diabetes. We can talk about the prevention of diabetes. I'm also going to be doing blood sugar checks, blood pressure checks too. So that's going to be really nice. And I just want to hear from you guys, so that is a wonderful opportunity that's coming up. We also have Dance for Diabetes. That's coming up on Saturday morning. If you go to the Bahamas, the BAF site, which is the BAF Financial, the insurance, there's information on there and how you can have fun. You'll be able to meet me there and get your exercise in, like we've all been talking about, and get to meet other people who, I think Combi is running that. And his energy is right up here. And we need that at 6 o'clock in the morning. I've also got several radio shows coming up, so please listen to me on the radio. And then going towards the end of the month, we also have on the 29th, I believe, or the 26th, the last Tuesday in the month, we have a Zoom in on diabetes, and Zoom in on diabetes is free. It's just like this. And we're actually talking about erectile dysfunction with Dr. Gregory Pinto. So that's going to be very interesting for everybody. It's not just going to have a slant on diabetes, but erectile dysfunction, which you know can happen in hypertension as well. So that's going to be really fun.
Yeah,
so those are the things that are coming up.
Yeah, that's a lot of information and a lot of opportunities. And so we are so thankful for them, because a lot of those opportunities are also free to the public and they're open to the public. And especially that Zoom call, you don't even have to leave your home. You don't have to leave the workplace. You can just log on and get informed, get educated so that you can start the process of acting. Yes.
Yep. And even if you're on another island too, which helps too.
Yes,
you can come in from, and we've never had that ability before, but now we're Zooming. It's amazing.
Yeah, connecting everyone throughout the Commonwealth and the world. Yes. Definitely. So just wanted to place a reminder, because I noticed that there haven't been any questions placed in the chat. And that's very good, because that means that everything was very, very,
I think I've overwhelmed everybody.
I don't know. I think you broke it down very, very, very thoroughly for everyone too. But we have been receiving a lot of compliments, Nurse Cates. The session was very educational and informative. Presentation was awesome. Thank you to NHI. Thank you, Nurse Cates. And so, yes, I want to say thank you again. And so I think this may be an opportunity right now for us just to segue into some wellness activities that we host at the National Health Insurance Authority. And then this would also give those an opportunity, if you still have time, if you still would like to ask questions, please place your questions in the chat. I noticed that there's a Rudell Garland. Your hand is raised. I don't know if that's a high five or if that's a question, but you can place your question in the chat. Rudell Garland, if you have a question. So in addition to wellness at the National Health Insurance Authority, monthly we host this educational session in either a face-to-face or a virtual session. We have been in a face-to-face session, we have been capturing audiences with different groups. I know in September, we would have partnered with the Anglican Churchmen. This month, we are partnering with the educators within the government on our private school system. And so NHI, along with Nurse Cates, will be visiting a few of our junior and senior high school educators, informing them of diabetes. But we also wanted to make this information accessible to the Bahamas at large via Zoom. And so we will continue in that platform. Every third Thursday, and it's interesting enough, in 2 days, we'll be hosting our Power Hour for the month of November, and I will show the flyer this Thursday at 6 p.m. at the NHI headquarters, located on East Street and Purpose, where you can join us for 1 hour of exercise. And Nurse Cates talked about moving, finding something that you like to do so that your body can no longer be in a sedentary state, but can also be in an active state. And this would also help to control and manage your diabetes and even prevent the acquisition of diabetes. And then third, we also distribute our wellness newsletter at the end of each quarter. And so if you are an NHI beneficiary and you do not receive any of our emails, I want to inform you that you can send us an email. You can give us a call, you can log on to our webpage, or you can find us on our social media pages and update us, provide us with an update of your email address so that you can join our mailing list. I had also promised to share our Power Hour flyer. And so we are inviting you to join us for the Power Hour free fitness session this Thursday from 6 to 7 p.m. It is free for the public. It is free for families. And so we are encouraging you to bring a family member, bring a friend, bring your colleagues for this session with Natasha Brown. We're reminding you to bring your exercise mat or a towel, and it's for 1 hour to get you moving. And this class is intended for individuals of all fitness levels. So Nurse Cates, a question came in the chat, and I'll read the question to you so that you can provide us with some insight as it relates to
Okay.
this question.
I will do my best.
Do the symptoms vary between men and women who have type 1 and type 2 diabetes? And is there an ethnicity or cultural variation in the symptoms?
I think that is a really, really great question. And the answer is thankfully no, because we are all human. We are all going to have the same symptoms. Now, remember, some of us don't have symptoms, right? We have elevated blood sugars, but we're only going to find them through that blood sample. Symptoms, remember, include the thirst, going to the bathroom, feeling dizzy, headaches, tiredness, and that is consistent. And there's no variability between type 1, type 2, different races and different cultures, because we're all human.
Thank you for that. Yes, I really did enjoy that question, especially about the ethnicity and the cultural variations. There was a second question that came in the chat, and I think it has to do with your meal plan or the meal options that you would have listed.
Right.
What guide can you provide to someone that may be lactose intolerant and pre-diabetic?
So lactose intolerant means that you cannot tolerate dairy, which quite honestly is very, very common in the Bahamian culture. Don't have that special little gene, that special little enzyme that breaks down lactose. So it's pretty rough. When it comes to the management of diabetes, we actually don't necessarily need to have dairy in our diet, so it can be eliminated. So the recommendations is that you just use the plate method. So half veggies, quarter would be of your carbohydrates, and quarter meats. And so you can use that with any plan, whether you have a little bit of pork chop with your green beans, and then you have your small amount of pork chop. Now, obviously, if you're making your mashed potato, you might not put milk in there. You may put water in there, or you may use a plant-based, such as almond milk, which might taste a little odd. Or, of course, we have a lactose intolerant varieties, the lactate varieties. The other thing you can do, if you're tempted, you can also get the little lactate tablets. I know Christmas is coming up, and I'm sure everyone's going to be tempted with all the excess, but that can be helpful as well. I hope that kind of answered the question.
I think it did. And Francita asked the question, so you can place a thumbs up, Francita, if you thought the answer was sufficient enough, and if you needed us to add something else, feel free to let us know.
Yeah. And you can come and check me out too on Friday. We can have a quick chat one-to-one, and I can show you the plate if you come and hang out with me at Kelly's.
I think I'm going to take you up on your offer as well, Nurse Cates.
Oh, I'd love to have you.
So what are your thoughts on dried fruits for a type 2 diabetic individual?
Oh, I'm so glad you asked this question. So dried fruit, any fruit, will elevate blood sugar. So it's all about moderation and amount, right? So if you're looking at like a tablespoon of raisins is going to be a serving of fruit. So you have to be very, very careful, because those are little power nuggets of sugar. So my recommendation always, always, always is to check your blood sugar before you eat it, and then check your blood sugar about 1 to 2 hours afterwards. And if your blood sugar has gone through the roof, then it's not going to work for you. So yes, dried fruits can be eaten in small amounts and as part of your plan. So yes, they can be used.
Yeah, I think we often forget that yes, fruit is healthy, but it also contains very high amount of sugar. And so diabetics in particular but the healthy population, but also diabetics for sure, has to be very, very mindful of that fact. Yeah, that nutritional fact as it relates to fruits.
Yeah, and we all should, because we all overdo it, right? Because it's
Mhm.
so easy to eat a bag of dried fruits,
Grapes.
especially when it's got the grapes, and they're so good at the moment, Trust me, I'm going through those like a dime a dozen. And we're looking, believe it or not, a serving size of those big grapes, those really lovely green ones that are in the store right now, you're only looking about 7. That is a serving size. And I don't know about you, but I can eat more than that.
Yeah. I normally get a
Yeah.
bowl or a cup, which is
Right,
definitely more, which is more than
exactly.
7. Yeah.
So again, for the
Uh,
people who are trying to manage their diabetes, checking your blood sugar and finding out what works for you is imperative. And I do want to say, as part of ACE Diabetes, we do a session called 5 to Thrive. And that is a course over 5 weeks. It's on Zoom and it's all free. And you're going to be able to learn this. You're going to have full access to me for all these types of questions. And you're going to have support outside of the sessions through WhatsApp, email, and telephone calls.
Thank you for that. Thank you, ACE Diabetes, for making a difference too. So one more time, Nurse Cates, can you remind us what time will you be at Kelly's on Friday for conducting the screenings?
Right, my plan is to get there for 8:30 and get my tent up and get set up. And I will probably be there until about 4 o'clock.
Okay, that's a whole
by
day.
4 o'clock, I'll be done. Yeah.
Yes.
But I want to give everybody the opportunity to come and say hi and, hang out.
Thank you so much again. And so we appreciate Nurse Cates for taking your time out of your busy schedule to educate us further on diabetes, what you need to know. I also would like to take this time to thank all of our participants that would have logged on to the call this evening. I think our numbers went as high as 82. And so that was very impressive. We have also been recording the session this evening. And so you can find the recording on our social media pages, particularly on Facebook and YouTube, which will be up within 24 hours. There's a comment in the chat that says, but I am in Eleuthera.
The land of the free. I do want to say that,
yes.
Yeah, I mean, and it's fine. Darren, I get it. I understand you're in a Lutheran, and thankfully we do have Zoom, and a lot of these education sessions are on Zoom. I do want to say that Family Medicine Center is over in Rock Sound as well, so you can get support. They are taking on NHI clients as well. So you do have full support with your diabetes on the island of Eleuthera and Rock Sound.
There's a question, and I think it's important for us to capture this question because we may have some other persons that may have also dealt with a similar case. It's a testimonial too. Last August, my husband was diagnosed with diabetes mellitus. He had all classical symptoms on his doctor's visit. His blood glucose was 299. He was immediately placed on Janumet. His blood results came back, and with days, he had to commence insulin for A1C 14. 2 months later, it dropped to 7.2, and the insulin was discontinued. 6 months later, it dropped to 5.6. Was he really diabetic?
I would say in this case, 99.9% of cases like this, absolutely. So what had happened in this case is obviously your husband's blood sugar was through the roof. He was feeling really bad. But once his blood sugars came down and he was eating healthy, I mean, clearly his blood sugars are much, much better now. He's running up, his A1C is at 5.6. If your husband were to change back to what he was doing, or if he was going to have one of the glucose tolerance tests that we were talking about earlier, his blood sugar would still show that he had a problem with diabetes. So yes, once it reverses but goes into remission. So your husband is likely to be in a remission. He's likely to be managing his blood sugars, but sadly, it's still there lurking in the background when diabetes is challenged with high amounts of blood sugars.
So in that case, he definitely has to continue to modify his lifestyle.
Yeah, absolutely. Or else he will actually slip back. I mean, it's amazing. I'm just seeing here that the Diabetes Institute were really impressed, and absolutely, and so they should be. And it is testament that when you do change your lifestyle, your blood sugars can change and bring everything to normal. So that's what we're hoping for. The insulin too is not a bad thing. The insulin gives the pancreas time to kind of relax. Okay, I've got this. Now I can continue producing the insulin that I need. So being on insulin for that short period of time has really helped heal those cells that were being damaged from the high blood sugar. So bravo to him for being brave enough to go on that.
Chronic disease management, that speaks volumes. So what we're talking about tonight, management of diseases of all types, is definitely so important. It extends your quality of life. It extends the length of your life. And this session this evening is testament that it works, but it only works if you get help, okay? And so you should not have to fight any chronic disease or any disease alone. Being diagnosed in itself, it's a scary situation, and it can be a very, very, it can generate feelings of loneliness. And so that's why it's important to make sure align yourself with individuals, with healthcare practitioners, allied healthcare professionals that can give you the support that you need. Even getting support groups with individuals that are going through the same issues or the same struggles, and that can give you hope. Because where there's life, there is definitely always hope. And so again, tonight, thank you, Nurse Cates. Thank you to our listening audience, to our participants. Stay tuned for more to come as it relates to NHI Bahamas. We hope that you can join us on Thursday at our Power Hour session, and stop on by Friday at Kelly's and say hello to Nurse Cates. And if you haven't had your screening, your blood pressure screening or your blood glucose tested in a while, please stop on by. Takes literally seconds, a matter of seconds, and it takes a few minutes just to get the results immediately after. And so have a great evening, everyone. Thank you again. Thank you.